The aim of health equity is to give every individual a fair opportunity to reach their fullest health potential. Research from McMaster University and around the world clearly shows that not all populations have the same health outcomes, and even in countries with universal healthcare, discrepancies in health outcomes exist between racial and socioeconomic groups. Marginalized communities in particular are communities which experience discrimination and exclusion because of unequal power relationships across economic, political, social, and cultural dimensions. This includes people of color, immigrants and refugees, sexual and gender minorities, indigenous people, people living with disabilities, and much more. These communities have several barriers to receiving equitable access to health services, often resulting in worse disease prognosis and lower life quality and longevity outcomes. These discrepancies can be caused by various factors, which will be described in this video, such as a lack of access to a family physician, a lack of health education, social determinants of health, language barriers, and other related disadvantages. This video aims to outline the discrepancies related to healthcare in marginalized communities, the effects a lack of health equity can have, and finally, provide solutions for increasing health equity in society. This video has also been made in collaboration with Dr. Fatima Jackson-Best, a joint professor in the School of Health Research Methods, Evidence and Impact, and the School of Medicine at McMaster University.
Hello, my name is Dr. Fatima Jackson-Best. I'm currently an assistant professor in the Department of Health Research Methods, Evidence and Impact, and the Department of Medicine at McMaster University. I'm also the project manager of Pathways to Care, which is a systems-level project with Black Health Alliance at the helm that seeks to improve access to mental health and addiction services for Black children, Black youth, and their families in Ontario. This has been my current research program since 2018, and it has been the greatest privilege of a lifetime to lead this work and to work with so many talented individuals on this project.
Canada has a universal healthcare system where all citizens are granted healthcare. Why do issues with health equity still exist?
Unfortunately, health equity is not a direct consequence of having a universal health system. Although Canadians are not charged for health services, an unequal distribution of healthcare still exists. One evident example of this is seen in mental health care services. For instance, wait times amongst Black Caribbean Canadians is up to 16 months for mental health care supports and services. This is in comparison to 8 months for white Canadians and shows a clear disparity and inequity with regard to access to mental health care supports and services.
So what are the social determinants of health?
Determinants of health can be personal, economic, or social factors that determine individual or population level health. Some common social determinants of health include income, so people's employment or their working conditions can be a huge determinant of health. Also, social status, people's education levels, their literacy levels can also impact their health and is a social determinant. In addition, childhood experiences and social supports, as well as gender, culture, and experiences of racism are all social determinants of health.
What is the relationship between the social determinants of health, such as race, income, or culture, and accessing healthcare?
We see a great disparity in many marginalized communities in accessing healthcare due to a lack of understanding of the medical framework in Canada. This includes difficulty understanding the medical system, people knowing their rights to services and within services, and also what to expect and the role of the healthcare provider, and also managing appointments. This is of special concern in areas with greater immigration populations, where cultural beliefs may conflict with the standard of care in treatments offered there. Language, transportational barriers, social stigma, or insufficient coverage are also other factors that discourage many from accessing the healthcare that they need.
So what are some ways we can increase health equity in marginalized communities? There are 5 primary methods. The first is to increase socio-demographic data collection in healthcare.
Mandate collection of socio-demographic data across the healthcare system. Keeping thorough data regarding the differences in demographic-based health outcomes will allow health systems and researchers to have knowledge of the gaps in the healthcare system, which will allow for opportunities for reflection and improvement.
Next is to increase health education in marginalized communities.
Investment into large-scale programs which aim to educate and inform communities about disease, about where and how to get treatment, and also their rights as patients, dispanding barriers and disparities related to navigating the healthcare system.
Third is to embed health equity in metrics of success.
Embedding health equity into definitions and metrics of success and quality improvement to actually monitor progress being made. This involves including health performance indicators focused on health equity into government accountability and funding and/or investment agreements in relation to delivering healthcare.
Fourth is to enhance social investment and community capacity, specifically in areas of marginalized communities, including investments in social, mental health, and addiction support.
This involves putting forth policies that address stigma and expand consumption and treatment services and safe supplies programs, developing culturally relevant and targeted strategies to address mental health and addictions, such as the utilization of traditional knowledge or medicines for marginalized communities like Indigenous communities and peoples, and prioritizing policies focused on income and affordable housing, both of which have massive impacts on our health.
And finally, confronting historical and systemic barriers.
This includes funding and supporting organizations that work on anti-racist and anti-oppressive approaches to healthcare, as well as improving funding within medical education and healthcare training programs to confront issues of colonialism and racism and other systemic barriers. Pathways to Care is the example of a project that centers the experience and the reality of anti-Black racism. We know that it exists, and we also know that it impacts negatively the ways that people go through mental health care services, whether or not they even access or gain access to mental health care services, and also the ways that they're treated within the mental health care services that they may be accessing. We are working from a perspective where we do not take for granted the centrality of anti-Black racism, and we recognize that the only way to combat it is to completely undo and transform our societies so that anti-Black racism is not an omnipresent, ever-present force.
To get involved or to learn more about Pathways to Care and what they're doing to improve mental health and addictions care for Black children and youth, please visit www.pathwaystocare.ca.
As we have learned today, inequity within our healthcare system continues to be a challenge faced by many, especially those in marginalized communities. Fueled by social and economic and cultural health determinants, it's clear the awareness of the medical framework, rights of patients to services, and navigating treatment options that align with cultural beliefs all work to overcome some of the barriers faced by patients. Quantifying health metrics, increasing health education, and also addressing the historical and systemic barriers to healthcare are also vital in promoting health equity, as outlined by the Canadian federal government. Such initiatives facilitate the transition to a more equitable, compassionate, and safe healthcare framework where accessible patient care is always the top priority. We hope this video has enlightened you on the healthcare disparities faced by Canadians and how we can work together to overcome them. Thank you for watching.